violence, and lastly, loss of money or valuables, because as soon as the members of the family becomes have this substance disorder, then the person will really sell those things that are still needed in the home, in your home, no? Likewise, the community is also affected by drug addiction. Namely, there is an increase in petty crimes within neighborhoods. Number 2, increase of drug dependence and drug pushers. Number 3, developing fear of drug users among residents, especially at night. Number 4, neighborhood association and interaction is reduced. There is an increase in heinous and antisocial crimes. Number 6, overwhelming fear towards drug dependence, limiting people's movement, especially at night. And number 7, disregarding of moral values and the deterioration of the moral fiber of society, leading to prostitution, pedophilia, child abuse, and other immoral acts, because these are the effects of taking these drugs, no? And lastly, a threat to national security. So this is, at this point, this is where the government has really intensified their campaign against illegal drugs, because of the effects of this illegal use of drugs in our society. So that's it. As to myth and facts, no? Number one myth is that all drugs are addictive. The fact is, some drugs can create addiction or dependence much quicker than others. So that's what is true and what is just myth. Number 2 is that only drug addicts have a problem. The truth is, addiction or dependency is not the only problem drugs can cause, no? So there are problems that don't necessarily need to take drugs, no? Number 3, myth is all illegal drugs are equally harmful, no? The truth is, different drugs can harm you in different ways. So, and lastly, myth is young people are tempted to try drugs by pushers. But the truth is, most young people are introduced to illegal drugs by a friend or someone they know. Okay, now let's talk about the risk factors of substance abuse. When we speak of risk factors, these are factors that increase your susceptibility or vulnerability. So number 1 is a family history of substance abuse. So maybe one of the members influence another. And then number 2, a mental or behavioral health condition such as depression, anxiety, or attention deficit hyperactivity disorder, ADHD. So these are other risk factors. So if you have this kind of behavior, then you have to be attentive as to how you're going to respond to this positively. And then number 3, impulsive or risk-taking behavior. So if you have this kind of personality, impulsive, risk-taking behavior, so we have to be very careful, because it might be, you might become vulnerable in substance abuse. And then a history of traumatic events such as experiencing a car accident or being a victim of abuse. So the traumatic events that you encounter. And then low self-esteem or feelings of social rejection. So this is where peer pressure is really strong. Now, what are the commonly abused substance? So here I will just enumerate the commonly abused substance. Number 1 is alcohol, no? So it's not just about drug, it's not just about medicine, but all those having the substance that alter your conditions, no? Your physical and mental. Number 2, caffeine. Number 3, nicotine. So nicotine is on your using cigarettes. Number 4, marijuana. Number 5, cocaine. So in your coffees, no, you're taking coffee. And then 6 is ecstasy. So this is really a used for those drugs that are found in the pharmacy. Shabu is sold illegally, and then benzodiazepines or pains or these are those depressants, no? Okay, how to prevent drugs? Number one, you have to maintain good physical and mental health, no? Number two, use drugs properly. So that's what is suggested. Most drugs are beneficial when used under medical advice. Okay, so here we have to distinguish that all medicines are drugs, but not all drugs are medicines, no? Number three, understand your own self. Accept and respect yourself for what you are. So do not be pressured by those friends who will influence you in bad situations. Number four, develop your potential. So you have to engage in sports, engage in wholesome, productive, and fulfilling activities. You volunteer, use your energy for more meaningful and fruitful activities. Number five, learn to relate effectively to whom you can communicate your problems freely. So it is really important the strong bond of your family, so that you can be open your problems freely. So for those who have already developed this substance use disorder, we have the treatment of drug addiction. So I will now change this into drug substance use disorder. So the treatment of substance use disorder can be done on the following depending on the situation, namely withdrawal management. So what is this all about? So there must be a psychiatrist and those in the medical field to assist you how to withdraw from these situations. And then number two, detoxification. Also they have to remove these toxins that are drugs that coming from drugs. Number three, rehabilitation programs. So we have centers here in Davao City. We have drug rehabilitation, so that those who would like to give up on this situation is also being helped. Then outpatient treatment, we have residential rehabilitation, and then lastly follow-up and aftercare. So these are the treatments that will be provided for those who are already dependent on drug or those who have already substance use disorder. That is all for my discussion about drug education. If you have questions or clarifications, feel free to message me. Thank you for listening.